You got to understand that that's one way of encouraging a safe environment. Now, if it's a public, um, a place that offer service to the public, you're not only putting your co-workers at risk, you're also putting the general public at risk if you're not vaccinated. So I think more and more as people get serious and understand the implications of this virus, that you will see more and more people trying to implement systems like this.
That was Minister of Health Dr. Frank Anthony responding to questions raised on Tuesday with regards to government's position on mandatory vaccination. Just a week ago, the Private Sector Commission, in a statement, called for its members to require vaccination for its employees and further recommended that employees who refuse to be vaccinated must provide evidence. Already, business establishments such as Giftland Office Max are imploring their employees to get vaccinated or produce a negative PCR COVID test at the beginning of each week. More so, it was divulged by President Irfan Ali during a sideline interview last week that the government is assessing ways to increase vaccination, and it was expressed that persons may need to provide a vaccination card to enter restaurants and other social settings. Interestingly, Guyana is not the only country moving towards mandatory vaccination, since other countries such as France have made vaccination mandatory. A number of states in the U.S. has also been mandating that all city employees access weekly testing or get vaccinated as the clamor continues to bring an end to the pandemic, which has been aging now for the last 20 months. For the most part, COVID-19 has evolved into a pandemic among the unvaccinated, since worldwide only persons who have not taken the jabs are becoming hospitalized and dying of the disease. Against this backdrop, Minister Anthony, in responding to whether there is a legislative agenda for mandatory vaccination, said, I quote, "We are looking at what is evolving," end of quote.
From an epidemiological point of view, and we would take all the necessary steps to ensure that people are protected.
According to the minister, persons will continue to get infected and possibly die unless the population is fully vaccinated. The minister reminded that studies have proven that vaccinated persons are less likely to be severely affected by the new and deadly Delta variant, a variant the minister once attributed to the increase in COVID infections and deaths in children locally.
We still have to get people to understand the seriousness and importance of getting vaccinated. And especially in the light, if we're going to be able to ride this wave of a delta wave, then vaccination is absolutely essential.
As of Tuesday, there were 248,970 persons who had received their first dose of a COVID-19 vaccine. This figure represents 5.1% of the adult population. 133,987 persons are now fully immunized, representing 27.5% of the adult population. To achieve herd immunity, an estimated 85% of the country's adult population will need to be fully immunized. So far, the biggest obstacle with regard to attaining herd immunity, the minister said, is caused by continued hesitancy, which stems from misinformation disseminated on social media.
In a very short while, you have on social media people, a lot of them who are not science-based, who have no expertise. Suddenly they're becoming the experts at vaccination, right? And they spread a lot of myth.
Reporting for the HGP Nightly News, Kendell Richmond.